This webinar was recorded for subrecipients of the Tennessee Strong Families Grant on February 27, 2025. Hannah Whistler, MSW, LCSW, and outpatient therapist, was our subject matter expert presenter. The training was presented for subrecipients to learn the symptoms and risk factors for postpartum depression and anxiety, identify ways to advocate for those experiencing postpartum depression and anxiety, and obtain resources to support families who may be experiencing perinatal mood disorders. The slides and reference materials are posted on our webpage for your reference and review.
Thank you everyone for attending today. We're going to be obviously talking about postpartum depression and anxiety. Okay. Like Chase said, my name's Hannah. I'm a licensed clinical social worker. I live in Raleigh, North Carolina right now. I'm originally from Maryland, and then I went to undergrad in Harrisonburg, Virginia at James Madison University, which then led me to Raleigh, where I started my master's program in social work at NC State University. My internship is kind of what got me excited about this topic. So I interned at Duke University Hospital. It was kind of like this dual internship where half of the time I would spend in the doctor's office for high-risk pregnancy. So I was meeting with moms who had high-risk pregnancy, and for the postpartum visits, I'd visit with them, see just kind of how that transition was. And then the rest of the week, I was actually in the hospital, meeting with moms soon after birth, just providing resources, community resources, private resources, specific to postpartum depression and anxiety. So you can see here, these are my personal pictures. I recently had a baby. I had my first baby. I'm 9 weeks postpartum. And my baby is a little girl. Her name's Bobby. That's her in the picture, and our dog, Tony. So the objectives of this presentation is for you all to be able to learn and understand symptoms and risk factors for postpartum depression and anxiety so that you can spot it, or so that you can just be aware when speaking with moms. Learn ways to advocate for those experiencing postpartum depression and anxiety. So when you are confronted or you meet with a mom who is experiencing any of these symptoms, you then know what to do. And lastly, to be able to give them resources, to know how to find those resources and to have them on hand. So just some disclaimers. I'm going to possibly say PMAD, or perinatal mood and anxiety disorders. There's plenty of those types of disorders, but today we're just going to be talking about depression, anxiety, and OCD. And then this topic, there's so much research and it's changing all the time. And so I'm going to encourage you to do your own research, especially specific to your area. And I included some research that might have percentages that are different than what you might find. So I just wanted to give that disclaimer. It doesn't mean that what I have found or what you have found is wrong, but it's just specific to the research. Okay. So what is postpartum depression? It is major depressive disorder with the specifier of postpartum depression. So just meaning it's very similar or is major depressive disorder. And the ways that we can diagnose that or look for the symptoms that make us understand or know that it is postpartum depression is something called SIGI-CAPS, the acronym. So if there are any changes to sleep, interest in things, guilt, energy, lack of energy, more energy, it could look like staying up all night, that's higher energy, concentration, lack of concentration, changes in appetite, the increase or decrease, psychomotor agitation, just meaning like moving very slow from one thing to the next, feeling like you're not very present or connected to the thing that you're doing, and risk of suicide or suicidality, thoughts of it. Postpartum depression is diagnosed when symptoms persist for at least 2 weeks. So we're looking for that 2 week marker. If it's before that 2 week marker, it's too early to diagnose. And it could go on for you might hear a mom say, I've been experiencing this for 4 weeks. So obviously that's more than the two, and that's going to tell us this could be postpartum depression. And the postpartum period is from birth until 12 months. So you could be diagnosed with postpartum depression at the 11-month marker. It affects 1 in 7 women, or 15%. And then if you have a history of mental health, or even during your pregnancy, you experience depression, you are more likely to experience postpartum depression. So oftentimes, we're questioning, is this baby blues or postpartum depression? Like I said before, we're looking for that 2 week marker. So baby blues is likely less than the 2 weeks, or we don't have enough symptoms to diagnose for postpartum depression. And so then it's likely baby blues. Baby blues is a little bit more common, and I think it's just this experience that validates the huge transition in our lives. And so, again, it's a good question to ask, is this baby blues or postpartum depression? And going back to those markers of, is it 2 weeks? How many symptoms do we see? Um, Risk factors. So obviously we see a lot of risk factors here. I'd like you to use the chat to think of like any risk factors not mentioned here that could be risk factors for postpartum depression. So this is a very vulnerable time. We want to have support. If we don't have support, it's going to make all of these things so much harder. One thing that comes to mind is birth trauma. That's not on the list, but if you had a traumatic birth, you then could be in that newborn stage still processing the traumatic birth and have that increase or that risk of postpartum depression because you're still processing. It's been very hard. So if you guys want to use the chat to just kind of discuss what else comes to mind when you think of risk factors for postpartum depression. Yeah, that's a good one. Previous pregnancy losses. Absolutely. This could be a really traumatic experience. It could bring up a lot of feelings of those losses, could bring up guilt, or even just shock of, how do I accept this new baby in my life while still honoring the losses I've had before? Anything else? Yep, birth trauma, definitely. Yeah, for sure. Is not expecting to be pregnant in the first place. You're trying to wrap your mind around this. Yes, we have 9 months, but that could fly by, or you don't have the resources that some people might have had planned even before getting pregnant. And so it's all just wrapping your mind around it. Awesome. Okay. I'm going to show this video.
Splits of famine into what's people streets. And hey there, hey there.
So I love that video. Feels very real to me right now. I can relate to all parts of that. I loved the piece of the spilled milk. And, there's that saying of don't cry over spilled milk. But I think what they're talking about is breast milk, right? That's so stressful. Um, and then the mom's eating really, really fast to get to the next thing. So it says 7 out of 10 women experience postpartum pressures. They're not talking about postpartum depression, just the pressures of postpartum. I think it really could be way more than that. I think every woman has experienced some type of pressure through that postpartum period. But I just love that video. And just what it represents. And then you see the baby get older, and then things just seem to be a little bit lighter at that point. So I think validating that too, that with the diagnosis, it's those 2 weeks, right? So 2 weeks is not very long. But as time goes on, we might start to feel that light come in. Okay. So I included this, and I'll just read the quote to you, but this is paid maternity leave benefits around the world. I recently heard on a podcast the correlation between maternity leave in general, unpaid or paid, if you're offered maternity leave, and the correlation with postpartum depression. So longer paternal leave was associated with better mental health. For example, a number of studies found decreases in depressive symptoms among mothers with longer leave, paid or unpaid. Other studies found longer parental leave associated with decreased risk of stress, reduced mental health care use, and lower rates of hospital admissions for mental disorders. And so here's just a chart of all of the countries that what they typically offer for maternity leave. Okay. So with that, maybe we're seeing some changes. Before, I'm going to go back. You see that the US is 0. But maybe we are seeing some changes that we will be guaranteed paternal leave. And so as of January 1st, 2025, New York is now offering 20 paid hours for prenatal care. I know this is about postpartum depression and anxiety and the postpartum period, but I do think that we see the correlation of what is your prenatal experience and how does it affect postpartum? And so if New York is offering these 20 hours for paid prenatal care, could that help reduce the risk of postpartum depression or have positive effects for just taking care of yourself and maybe having more of a positive birth experience or whatever it might be? And will we continue to see states adapt to what New York is doing? So with risk factors, one of the risk factors was race and ethnicity. This is one specific study. And like I said in the disclaimers, you find different things in different studies. And so with this, I want to say that this is very specific states, and this was 5 years ago. And so there could be changes, and this could also not be every experience in every state or every hospital, but specifically this research has shown that healthcare providers offer in these states moms the postpartum depression screening, just kind of assessing where they are, and did not follow up specifically with African Americans, Asians, Native Americans, and multi-races. And white women were more likely to be screened and followed up. And so this is concerning because you could be telling someone on a piece of paper that you're experiencing postpartum depression and just be left in the dark. And that's awful. We don't want that, especially when you've taken that step to vulnerably share, hey, this is what I'm experiencing. And you're even told, hey, they'll give you a call if you score this. And then they never get that call, they never get resources. And so this is a very real risk factor. So what I was mentioning before is the PPD screening. This screening offers or asks questions based on SIGI caps, the sleep, the appetite, everything that I mentioned before, all of the depression symptoms. You're typically asked to fill this out either at the hospital or at the pediatrician, or maybe even at your OB appointment, the 6-week follow-up. If you are offering the PPD screening, please review the screening and follow up, especially depending on how they score. It's going to be even better if you can follow up in person right then and there, because it takes maybe 1-2 minutes to score, and you can ask them and provide the resources versus that paper being lost or for some reason someone not following up with that person. And I think that face-to-face follow-up is going to mean so much more to that mom, and it's going to create a more vulnerable experience where the mom is face-to-face with someone asking those questions or talking about it versus getting a voicemail. But I think that that's really important, so that they understand the importance of getting help. So what that could look like is, I see you marked that you're having trouble staying asleep nearly every day. This can be normal as a new parent, but do you mind sharing more about that? How many hours of sleep are you getting per night? So the PPD screening will say something like, are you losing sleep? It's a very broad question, but if we can specify it more of how many hours of sleep are you getting per night, we get a better idea of what's actually going on. Is there anything keeping you up besides the baby's needs, right? So the baby's needs obviously are going to keep new moms and new dads up, but with this type of question, it's open-ended, and we're finding out, is there anything else? Are there anxious thoughts? Are there suicidal thoughts? Are there OCD-like thoughts? So just trying to be more specific. And when you provide the PPD screening, I think it's important to provide the education about postpartum depression and resources to everyone, but especially those who score higher. So there's a square there. I'm going to work around that and you'll get the idea of it. But this is the interpretation of the screening. And so, like I said, you'll be asked like 9 questions based on those 9 symptoms, and you'll score a certain way. So it's like a Likert scale, and it'll say never, sometimes, almost never, always, or whatever it might be. And so at the bottom of the PPD screening, typically for the healthcare provider, there's an interpretation of how to read how the patient scored. So if they scored between a 0 and 4, there isn't much severity of depression. But again, we want to provide resources, whereas as the score goes up, there's more risk of depression, or the depression becomes more severe. So as we're meeting with moms, we want to be aware of implicit biases, or even just couples if people come together. When you walk into a room, being aware of, do I have a bias toward this person? And I don't mean that it's obvious or that this is incorrect on your part, but the things that we assume or the things that we've heard. And so a good question to ask yourself is, would I respond the same way if this person was X? So if this person looked similar to my husband, or looked similar to my family, looked similar to my friends, would I give them the PPD screening? Would I call them back? Would I not call them back? Would I assume something about them? And I just think that this cartoon or comic is a good idea of what implicit bias looks like or is. So similarly, consider your assumptions or possible beliefs you hold about this characteristic or population when you see them. So just being aware of walking into the room, okay, this is this characteristic. Do I have any thoughts or beliefs about this characteristic? You're asking yourself that. And that then will inform how you are caring for them. So, an example is if someone shares that they engage in drug use, you might discredit that their symptoms could also be PPD rather than it's just drug use, right? So, we want to challenge those thoughts. Another option or example is this X population has a lot of family community support. And so I'm not going to ask them about their family or community support. We're missing out on a chance to really understand how can I help them? Or are they struggling in some way that I don't know of because of the assumption I'm having? Okay. So we've covered a lot of postpartum depression. Now we're going to move on to anxiety. Um, what we're looking for is constant worry, feeling that something bad might happen, racing thoughts, right? I mentioned sleep before. Those racing thoughts are going to keep us from being able to sleep. Inability to sit still because of those thoughts, or because you feel like you need to be on, or you can't find grounding. Physical symptoms could include dizziness, hot flashes, diarrhea, nausea. Feelings of anger or irritability or rage. Postpartum rage is very real too. Nervousness, on edge, anxious, trouble relaxing. And 1 in 5 women experience postpartum anxiety. So I think oftentimes it's easy to discredit postpartum anxiety because we kind of invalidate that. Yeah, of course you're going through this huge life change. Why wouldn't you be anxious? So, postpartum OCD. So it's characterized by repetitive, unwanted, intrusive thoughts. And we deal with those thoughts through compulsion. So we have this thought and we want to kind of eradicate it, get rid of it through this compulsion. Um, Oftentimes, postpartum OCD can bring about a lot of shame or um, guilt because of these anxious, intrusive thoughts. They're not thoughts that we want to be having, but we want to validate this comes from a place of concern. This comes from a place of loving your baby. And so your mind is doing all of the hard work of trying to think through worst case scenarios, but it's on overdrive, and we need to figure out what is this happy medium of what is a realistic anxious thought given now being a mom, and what is changing your life completely with these compulsions taking you overboard. Um, so postpartum OCD is prevalent around 2 to 9%, with the typical onset occurring within the first 8 weeks. So how can we prepare for postpartum mood and anxiety disorders before postpartum even comes about? We want to inform moms of the risk factors of the PMADs and take preventative action. So I give a few options or ideas of what preventative action looks like, but knowing the symptoms and informing those around you, because like we said before, moms are busy, moms are going from one thing to the next. And so they may not even be aware that they're in a spiral or that they're experiencing an anxiety that was unlike the anxiety that they had before, or they might feel like this anxiety is normal given now becoming a mom. But we want to inform our support people so that they can also keep an eye out. The Fourth Trimester is a great book that I encourage moms to have. It's a postpartum guide to healing your body and balancing your emotions and restoring your vitality. identify your personal support people and collect local resources such as lactation consultants, mental health therapists, and free support groups. So before I went into my postpartum period, I had a document full of lactation consultants, mental health therapists, and different support groups that I was thinking of. You can have that on your phone or on your laptop, or follow local accounts on Instagram or social media. Um, there was a resource here in Raleigh. I can't think of the name of it anymore, but it had a list of all of these supports that I've mentioned before. And you could put in your zip code and see how close they were to you. So I'm not sure if there are things like that in Tennessee, but it would be worth looking for. And then lastly, setting up a meal train or having someone else set up the meal train for you and delegating tasks. What are the tasks that you think during postpartum will just take it out of you? For me, that looked like taking care of our dog, right? I couldn't do that on top of taking care of a baby. So I had to tell my husband, you have to take care of our dog. Okay, so postpartum in a nutshell has been said to be similar to a candy bar. So the chocolate represents the baby, the wrapper represents the mom. So the wrapper carries the chocolate for some time until the chocolate's ready to be eaten or the baby is ready to be here. And everyone's excited about the chocolate and throws the wrapper away, right? Oftentimes, when people go and visit moms, they're asking about the babies. How's sleep? How's the baby doing? What's baby gaining in weight? How's the baby feeding? Things like that. But we could be focusing more so on moms and thinking about questions to be asking mom that are, again, more personal, more considerate of this huge transition that she's going through. So I thought PMAD was something that only affected moms. This is a quote from a story that we're about to watch, but dads also experience postpartum depression. And that's what it's called for them, postpartum depression. And we see anywhere between 5 to 10% of men experience postpartum depression. And Postpartum Support International offers a support group just for dads that meets completely free and virtual on Fridays. So I'll go ahead and take us to that story.
Hey, where do you want to go first?
And the foot side.
You want to go on this side? So we'll go over here so we can walk up? Okay. Dad will walk up with you, yes. I was excited to be a father. We got lucky and we got pregnant on the first try, and then we found out we were having a boy. I was very, very excited, and everything seemed fine. You know, the pregnancy went well, and then he came on time. And I'd say probably within while we were in the hospital, I started to get very anxious.
It's taken a long time for us to recognize postpartum depression in women, and it's going to take longer for us to really accept that strong men can also get postpartum depression or anxiety.
So, good job. When I would get home and my wife would give him to me, I would he would just start crying, and I would just hand him right back and say, I don't want him. And by about week 4 or 5, I started to say some very mean things and very hurtful things about him to my wife, just saying that there was something wrong with him and that he was just going to be the end of our relationship and the end of our lives. Whoa!
Big, huge study came out in 2006, and many since then, that recognized in this study of 5,000 men that 1 in 10 men also get postpartum depression or anxiety. It looks a little different in men. They tend to check out, play video games, hide in their man cave, irritable, angry, this initial high, and then they kind of crash.
The dark thoughts that I had in general were of the homicidal, suicidal variety. And they were very vivid, and I can remember them. I mean, I try very hard not to think about them, but I remember what they were. I could see it very clearly.
dads feel a tremendous amount of stress. And we have to recognize that. So many years, dads have been kind of relegated to the sidelines as the support person without our recognizing that they're having an emotional experience of becoming a father as well.
You know, one thing that I've learned is that there's a big difference between thinking something and doing something. And a very wise doctor told me that you're entitled to thoughts, and thoughts are not actions. That's how you work through things. That's how you realize things about yourself. All right, big boy, ready? One more big swing. If you think about fathers, societally in America, men are supposed to be breadwinners. We're supposed to be the rocks for our wives. We're the men. And being a man is not usually associated with having doubts about being a father or crying or weakness. So it makes it doubly hard, I think, for men in America to talk about this even with their own spouses. Go back so we can swing ourselves. He's 2 years old now, and the way that I kind of felt those first few months, just it's so far in the background now that I can't even I can't imagine why I felt that way when that happened, because I see him now, and so much of my worry and anxiety was that he wouldn't be like this when he was 2. And so now I feel like, especially given what I do for a living in pediatrics, I know that I'm very lucky, and I know that I have, that whether by just Mama's on the other side, that whether just by, good genetics or just the way we've raised them or what, but I tell everybody, I'm like, I have the kid I needed to have.
No more.
No more? You don't want to swing anymore?
No.
Okay. I'll just let it stop. He's a good kid.
Bye-bye. Bye-bye.
I loved what he said about, I think that he said that his doctor validated that his thoughts aren't actions. And I think that's something that we can say to moms, dads, whoever that are having experiences of anxiety or depression, of the thoughts that you're having are coming, but they're not something that you're acting on. And it's very normal to experience these things. And I've heard too that we start to see a shift in dads when babies start to engage with their dads, right? So they don't start smiling until anywhere between like 6 to 8 weeks. And so that could be a long wait of, dad just holding baby and baby just crying and then calming down. And that might be enough for a dad to feel validated in his efforts, but it might be more of that start of the relationship where dad does feel like his efforts are making a difference, right? Moms can feel more of that because they're nursing, or they just have this chemical connection to their child that dads just don't. Okay, so I don't know if you guys have heard this, but this is a new campaign called Get Your Pink Back. And it's something that an influencer started. So flamingos, when they have babies, they lose their pink color, so they turn white because all of their energy is going toward their babies and taking care of their babies, energy, nutrition, all of the things. And then as the baby starts to grow, they slowly get their pink back. And so this influencer who had heard about this experience took this idea and ran with it and started to encourage moms of, you will get your pink back, right? Those newborn days, or even those first 12 months, it's giving a lot of yourself, and you're going to do that for as long as you have a child, but especially during those first 12 months, and eventually you will get your pink back. So these are resources that I just wanted to offer you guys to have on hand. So the WIC program or the Medicaid program created this really great resource here. So this is the website, and then you click right here, Pregnancy and Beyond Resource Guide. And right here, it offers a bunch of different resources for moms to connect with locally in the community. And I think that would be great to have on hand to offer moms or to tell them. There's this link that you could just send them. And then for free groups and information like blog posts specific to depression, anxiety, and beyond can be found at postpartum.net, which is the Postpartum Support International that we had seen, the dad support group, the Dove commercial. That's all Postpartum Support International. And they have so many resources on their website. And so does this company as well, postpartumsc.org. And then for a more holistic approach to care, there's postpartumcareusa.com. And that's where you'll meet with a therapist, you'll meet with nurses. And this is all telehealth. That's why I'm sharing this. And they will use insurance. But this is to just have a holistic approach of let's test your thyroid, let's test your hormones, let's test your blood, and let's see what's really going on so that we can kind of take care of all pieces of you in that postpartum period. And then the Tennessee Breastfeeding Hotline is here, and they have interpreters. And then this is the womenshealth.gov. The Office on Women's Health has a bunch of resources as well, kind of similar to Postpartum Support International, where they have different topics and just things to learn about if moms are wanting to kind of dig more into learning about certain topics. So that's all I have today. I know that Shay said that we would leave some room at the end of the presentation for questions. If you have any questions that you think of after this presentation, you can send me an email here. Yeah, I'll leave it up to you guys. And thank you everyone for attending.